I've listened with interest to the answers we've given so far. I mean, the Prime Minister said a couple of weeks ago there's going to be an end to incremental change and it won't cut it anymore. But from what you've said so far, it seems that our response to that in the obesity world is, well, at some point, once we get a framework and once we've done a review, once we get to there somewhere, we might actually start to take some more wider action. And the number of 220,000, while it's welcome on the GLP-1s, and I'll come on to that in a second about other models that might be available, 28% of people in this country are living with obesity, another 34% or whatever it's about live with overweight. Do you genuinely think that we are throwing the full might of the British state and the NHS at this problem, given the impact it's going to have not just on people living with overweight and obesity, but the impact it then has on people with type 2 diabetes, developing type 2 diabetes, heart disease, cancers? Do you genuinely think that we are on target and acting at the pace needed to achieve the moonshot?
So the moonshot is an ambition, and it's the right ambition to have, because the statistics are shocking.
I mean, it's a great ambition. We all agree on the ambition. And so, do you think currently the department is acting at pace needed to deliver it?
You mentioned the PM saying end to incremental change. So he set up delivery units in every one of the departments now. So we have a delivery unit and people that will be helping to drive this forward on behalf of the Prime Minister to fulfil that ambition. So I would imagine this is going to be one of our targets that we are going to have to up our game on. To be honest.
I understand, having worked within NHS structures for a long time in my previous career, the complexities around this. However, we can see when we put our mind to it, you can see how quickly the structures can move. Look at COVID, for example. That was a real time of national emergency. But I think that we talk about this in the same kind of scale in terms of the actual emergency that's coming down the line in terms of obesity and the impact it's going to have on our public health. And yet the scale of the response seems to be very much a business as usual response. And I guess when you go back to constituents like mine, why aren't we, for example, why couldn't we go out and text every single person that GPs have on record as being overweight and obese and offering them some kind of intervention in the next 6 months? Is it a resource problem? Is it a lack of capability? If we are really serious about this, and this is an urgent crisis, as all the rhetoric and our ambition says, why isn't that the scale of the response that we're providing?
On obesity, it's increasing and we need it to be decreasing, so there is a big problem to deal with. I accept that. Claire started to talk about cost. If you look at everybody who might be eligible for a GLP-1, the cost of the drugs is estimated to be $4 billion, and the wraparound services takes that to about $15 billion.
Yeah.
And I think the capacity in general practice that would be needed to support that, and it is important to support that, would be about 20% of the whole capacity. So the scale of that means that we can't do it overnight.
Okay,
and it has to
that's fair enough, and I think I'm probably someone on the panel who speaks quite vociferously about other models, having gone through a different pathway on the type 2 pathway to remission programme myself. We've seen the evidence from that. We've had evidence that the results on that are really impressive. People keep the weight off. It's cheaper, significantly cheaper than the GLP-1s, and actually has a broader impact on people's health. Why can't we, and that, given it's provided by private providers, there's wraparound care, there's an app, it's already there, ready to go. Why couldn't we roll that out to 2 million obese people over the next year?
That is currently...
it's just for diabetes, so why couldn't we roll it out for broader obesity?
How many are currently accessing the pathway to remission?
So again, perhaps it's useful to capture this in our more upstream early intervention programmes, if you like. So we have a suite of early intervention programmes, one of which is the Path to Remission programme. And again, this year we have embedded that within the Quality and Outcomes framework. And the intention of that is it increases visibility of those pathways of care that are available to people living with overweight and obesity and the qualifying criteria. But it includes within that domain in the Quality and Outcomes framework also referrals to locally commissioned weight management programmes. So that again is starting to adopt a more upstream approach, if you like, and support and enable access to all those programmes that can make a difference to people. In terms of the nationally commissioned lifestyle support programmes, we have over the period of time seen more than 2.8 million people referred into those programmes. So we know that a lot of people are able to access those programmes, and it's really important important, as Professor Fowler said, that we actually consider this in a whole pathway of care, and we're not focused on one area alone. This needs a multifaceted approach if we're to make a difference and support everyone.
And I hear what you're saying, but what I'm saying is that in terms of the urgency that's needed, so prevention is obviously really important. Lots of colleagues are going to come on to that. But we have, 28% of the population currently living with obesity. That is going to cost, and we talked about the cost of GLP-1s. What's the cost currently to the NHS of not acting?
Yeah, it's about 9 billion.
9 billion. And projections presumably going to go up and up and up over the
cost to society is, I think, over 100 billion of obesity. 107 billion. So.
And I think, and I think what as a committee, that I'm speaking for myself here, I get very frustrated is that we talk about the cost of individual measures, but actually the wider cost of obesity, and and I appreciate you probably having these same discussions with the Treasury, but we need the department to be banging the door down the Treasury and saying, it's not acceptable to kind of put these off against each other because of the massive cost that's coming down the line if we don't tackle it. On the wraparound support, we've had evidence from the leisure sector, particularly people like UK Active, saying that they want to get more involved, but there are barriers to them getting involved, and they would love to see, and the muscle loss point is a really important one, and all the evidence shows actually the exercise won't take the weight off, but it helps you with that kind of body composition piece and making sure that you keep the weight off in the long term. What more can we do to engage with the leisure sector to be, for example, should we be using more prescriptions of social prescribing into PTs, into more active spaces as well, as long as part of that wraparound care?
I think some GPs were using social prescribing for gyms, but probably part of earlier pathways. But I see what you're saying. I mean, maybe that is that currently part of the GLP-1 wraparound care that we offer?
It wouldn't necessarily specifically be, but there will be areas where that model of care does already exist. So, for example, where I work, we do have a model of care where that is accessible. One of the developments that we would hope to see through the emergence of our neighbourhood health models, again, is that much more holistic approach to care for the people living with the greatest complexity. And often that will involve liaison with whole partnership working across the whole system, including providers of physical activity and other locally commissioned services.
And in terms of the mental health support, as we heard in the video, the impact the lack of that has, what plans does the department have to try and roll that out and to make sure there are accessible pathways for people to get mental health support, particularly after they've lost a great amount of weight?
Yeah. Do we currently have pathways that include mental health support?
Within the wraparound behavioural support for obesity prescribing programme that we have developed, it is a fully comprehensive programme that looks at support for a behavioural change to support people more holistically. Within the commissioning guidance that we developed to support implementation across ICBs, we do make a number of recommendations. So, for example, where a GP has identified that an individual has a specific need, perhaps a more complex disordered eating concern or other mental health concerns, that they do, in addition to the behavioural support, make use of other local services that are available. And I think that's really important that is undertaken. And again, it just comes back to the fact that it's really useful that these pathways are being developed in primary care with GPs who know these individuals very, very well and can support them in that much more holistic way.
Claire will know this from my previous work, but I have a particular passion for young people living with diabetes. So I'm a type 2 diabetic myself, was diagnosed at 32. We've got a massively growing problem in this country of young people living with diabetes. Not all of that is obesity related, and we should be really clear. There's a lot of stigma attached to diabetes. A lot of people, only 50% of people with type 2 diabetes is related to their weight. However, obviously that is still half of a very large population. What are we doing to particularly focus on young people? Because we know that young people diagnosed type 2 diabetes and obesity related illnesses have their life expectancy dramatically cut. So in my own example, my life expectancy is 16 years less than the average now because I was diagnosed with type 2 diabetes in my 30s. That is a huge problem going forward. How can we, what is the department doing to focus on young people?
So, I mean, that brings us to the prevention discussion, which I'm really keen on, having a deep dive into as well.
We'll come on to that. I think in terms of the treatment base, how can we focus on younger people who perhaps aren't going to access services in the same way, aren't going to be visiting their GP for other things, who aren't necessarily, who might have the stigma attached. If you're young and you're thinking you're going to be, part of the Instagram generation, getting beach ready for the summer, and you've got all that stigma attached to accessing weight management services, how are we going to focus on that generation of people who desperately need the support now?
So it is worrying that the age for people being diagnosed with type 2 is coming down, and obviously I'm trying not to touch on all the prevention stuff and the healthiest generation of children ever, manifesto commitment, which I'm absolutely
on the treatment
side, I'm going to bring in Clara Aiden on the treatment of. Are you saying young people over the age of 18?
Yeah. So we're looking at young adults who are increasingly the ones who are being diagnosed with type 2 diabetes at a worrying rate, but also just generally getting more obese than the previous generation.
So whether we have a different pathway and treatment program for those young people.
So to touch on your point about young people with early onset type 2 diabetes, and again back to it sheds a light on the importance of data. We were able to identify that through the National Diabetes Audit. We understand that young people living with early onset type 2 diabetes often need a greater level of support. So as a consequence of that, we were able to implement a programme called the T2 Day programme, which is a specific focus on young people living with early onset type 2 diabetes, which is a funded programme which supported primary care practitioners to give a higher level, a more detailed review of young people, which was much more comprehensive, asking them specifically to consider things like psychological aspects that they may be living with, social concerns that they may have, a more comprehensive review to make sure that all their physical health care was better catered for, and that the treatment pathways that they were enabled to access were explored.
More
and
broadly,
along with
for
a
kind of
focus on women's
obesity,
health.
for more broadly weight management services, are there any similar pathways for young people?
We don't as yet have pathways specific for young people.
That's about the chat.
Thank you very, very much. Greg Stafford, please.
Thank you. Just touching